St. Roch Community Stroke Intervention Project, transition care from hospital to home. Stroke is still the fourth major cause of death globally, despite the development of novel stroke treatment strategies that enhance the patient care provision. Despite the new treatment strategies, there is still room for improvement through the adoption of criteria and certification processes for the stroke centers. The stroke care system coordinates the patient access to various services essential to stroke team management. Tulane Medical Center's policy is aimed at offering safe and high quality healthcare services for stroke patients and to enable effective communication between the healthcare services providers as a means of ensuring quality care safe discharges. The community, St. Roch, is faced with immense challenges of stroke as the disease is the fifth leading cause of death and disability in the community. The chosen community, St. Roch, is a community within New Orleans. New Orleans is known as the Big Easy, and St. Roch is in the heart of New Orleans. New Orleans is known for jazz, Creole cuisine, gospel music, jazz funerals, and a stew of cultures that are uniquely its own. In the inner city, there are two major hospitals. There are multiple corner stores that sell alcohol and greasy fried foods. New Orleans also has a large homeless and low income population. With this being said, education is very important for prevention. Both of these populations usually don't go to the doctor unless it's a dire emergency. Working in the emergency room, I see an increased number of strokes coming in. Educating this population on stroke prevention is very important. Windshield survey. The windshield survey of St. Roch indicates that it offers recreational, social, and economic services to families residing in the region, including schools and entertainment places. Several organizations exist in the community, including the Men of St. Roch, the Women of St. Roch, and the Young Families of St. Roch, amongst others. Several properties are up for sale in the community, including commercial stores such as supermarkets, pharmaceutical shops, malls, and boutiques. St. Roch has a multiple neighborhood bars and corner stores. Residents can be seen hanging out, drinking, smoking, and buying unhealthy food from the corner store. Community assessment data generation. The health status of St. Roch community is above average with insufficient but practically available vital statistics on the members' general health behavior. Approximately 80% of the community members below the average line smoke tobacco and 60% drink alcohol, and this is below the national average level. Tobacco, smoking, and alcohol consumption are risk factors for stroke. In St. Roch community, cerebral vascular accident or stroke is the fifth leading cause of mortality, with approximately 45 deaths for every 100,000 people. Community partners and resources. My partners in this outline was Crystal Geddes, RN BSN, Dr. Justin Solarian, Stroke Director, Dr. Tony Alvarado, Assistant Stroke Director. The resources were Tulane Medical Center, Tulane University School of Medicine. Develop community health diagnosis would be risk of stroke related to knowledge deficit among residents in the community and poor health care. Stroke discharge and prevention of hospital readmissions. We want a self care management. We want to set the stage for discharge planning, assess readiness to learn, provide written, verbal, and audio education, provide prompts for when and who to call before returning to the emergency room. Medication adherence. We're going to reconcile medications to reduce discrepancies, teach when, why, and how to take prescribed medication, include a pharmacist to educate and reconcile to avoid potential adverse events. We want early follow up and support, have follow up appointments set up prior to discharge, have patients set up with support groups prior to discharge, communicate with primary physician, community referrals, home care, population health. Communication and transfer of information include family and caregivers and discharge planning, access your own electronic health records, and know when to call 911. Patient's criteria for discharge, stable vitals, diagnostic testing complete, discharged by a physician. Proposed interventions for community health plan. The proposed intervention activities include education of the members of the community on the need to rehabilitate discharged stroke patients, create awareness on the stroke risk factors, and execute effectual rehabilitation practices. The implementation of the intervention will be in phases and will cover a period of 3 months. The first phase will entail identification and preparation of discharge from hospital to home or rehab facility. The second phase will entail the education of nurses and other healthcare workers on the need for decreased hospital readmissions of stroke patients. The third phase will entail the creation of awareness and education of the community members on the prevention of stroke. The final step will be continued stroke education and prevention of stroke readmissions to hospitals. The intervention and policy communication will be performed using emails, memos, and stroke education for nurses. The nurses and physicians residing in St. Roch community will be sent emails, and the memos will be placed in the healthcare facilities. Other notable forms of media, including television and radio, will be used in the dissemination of information to the member of St. Roch community. Different teaching and educational materials, including textbooks and posters, will be used in education of the nurses and the public on the intervention program. Proposed evaluation methods for community health plans. To establish the success of the intervention and research will be carried out to evaluate the number of discharged stroke patients visiting the healthcare facility for stroke rehabilitation services. And a decrease in the number of individuals returning to the hospital will imply success of the policy and attainment of its purpose. To evaluate the effectiveness of the intervention, the number of stroke relapse patients who have been admitted into the health facility and successfully treated and discharged will be assessed. The intervention success will be evaluated on the impact it has on the society in the long run with regards to reduction of stroke incidence rates and successful rehabilitation and treatment after suffering stroke. Conclusion: successful execution of stroke patient discharge and treatment policy within St. Roch community is dependent on availability of resources and partnership, effectual communication of the policy to the stakeholders, and inclusion of the members of the community in the policy implementation is recommended. The evaluation of the policy outcomes is vital and aspects, including the number of stroke patients visiting the rehabilitation center, the stroke relapse patients being admitted in the facilities, and the reduction of stroke patients in the community are vital indicators. Thank you.